how are you involved with UP?
So I've been involved with Appy for the past, I would say 10, 15 years. When I raised a lot of funds for Appy, and some of the Appy leadership brought me over, trying to help up. When I was the chief strategist for a company called Boehringer Ingelheim, which is one of the largest privately held pharma in the world, I was working for the CEO, and I was able to bring in $600,000 to Appy. This was 10 years ago. So I was maybe the guy who raised most money for Appy in the history. So I've been supporting Appy ever since. But now as a chief strategy officer, help to bring value to the members.
Very interesting. And you have a very fascinating path to how you came from India into the United States, and then your business flourished. Can you talk about?
It's a very similar story to many. Again, I'm an Indian physician. Came up to US with, I would say, $80 in my pocket in the US. But I had nothing, so I barely spoke English. And then I realized that there was a shortage of physicians in the U.S. Navy, and I applied, and somehow I must have had an entrance exam. I must have scored very well. They were, after me to get me on, and I did, and I signed up with the U.S. Navy at the Bethesda Medical Corps. That was interesting. It changed me. Again, I may not have made a lot of money, but if you wear a uniform, go to a bar, you might be able to, not be able to afford a drink, but somebody will buy you a drink. And they always left you thank you notes in your car because you have a veteran plate on your car. But it was interesting. But it changed me. Maybe also I'm thankful for paying for my business school in Michigan, and which changed my trajectory in life from being a doctor to a businessman to a hospital administrator, and trying to see if we can fix the system.
And is that why you changed courses? Because you wanted to fix the system? You sensed that there was something wrong?
Exactly, because I see many of my friends who were working, 40, 60 hours, a week. And, one of my best friends was a cardiologist at Columbia. And we tried to calculate how much money he makes per hour. And it was basically $9 an hour, average salary divided by the number of hours he's spending and doing it. I said, if I'm going to make $9 an hour, why can't I be working in McDonald's flipping burgers? I would make a lot more with a better quality of life, as opposed to all the liabilities you're gonna get. The lawsuits coming back against you. So I thought American system needs fixing, and there is things we can learn from the world. We can learn from what's happening in India. We can learn from what's happening in Europe. We can learn from what's happening in Canada. Again, I'm not saying any system is perfect, but we can create a perfect system.
You were thinking about this years ago.
20 years ago when no one else was. So my thesis, my business school was regarding survival of the US health system, and I predicted that system will collapse in 2015 because it wasn't rocket science. It was easy to say because healthcare inflation as a per cap, it was going much larger rate compared to GDP. So it becomes a choice. Do you want defense or do you want Medicare? Do you want Social Security or do you want uh, support for the seniors? So right now that's what's happening. It is obnoxiously expensive. We spend more money than any other country in the world, almost $12,000 per American per year. But do we have the best care? People have access to care. Many people don't have insurance. So I believe everybody should have access to care. I believe healthcare is a right for all. Because one thing COVID has shown us is that whether you are a foreigner or you are, a president of the U.S., you're still not immune to COVID. Diseases doesn't discriminate between whether you are a white, black, or Indian. It doesn't discriminate whether you have $1 billion in the bank account or you are broke, whether you have the Blue Cross of insurance or you have nothing. So it is time our country need to step up and give support for the people, essential healthcare. So again, I have a completely different way of redesigning healthcare. That's what I'm here for. I wrote a book about it, and which became a bestseller, and another one
What is
coming
the
out.
title?
It's called Beyond the COVID-19 Pandemic, Envisioning a Better World of Future of Healthcare. So we just got our hard book just released 1 week ago.
Can you tell us a little bit about it, about the book?
Sure. Again, the book is regarding how COVID got us with our pants down. If you, as I said, we are spending $12,000 a year on healthcare per capita, but we have one of the worst outcomes in the world. Almost 1 million people died in the U.S. one of the worst outcomes in the entire world. I remember when I was in, I was in China coming back from a business trip in, 1999 December. I knew Wuhan was shut down, and I saw people were buying N95 masks over there because the Chinese government banned people from walking outside without N95 masks. So I ordered some on Amazon. I got a big box when I came here back to US. But when I realized when the COVID came here, many of my hospitalist doctors, cardiologists, ICU doctors didn't have masks. So I was rationing, giving them, all my friends, emailing. In fact, I had several packages mailed out from FedEx shipments of 10 masks each because I had to ration. I don't have enough to give all my friends. So anybody who going into ICU, I was shipping masks to them. So it just shows us we depend on one country, China, for all our just-in-time inventory for getting a cheapest product. Was it the right strategy? So it's time we need to bring our manufacturing back home. It's time we need to bring our manufacturing local, especially healthcare supplies, like essential supplies like healthcare. We need to mandate, like what military does for missiles or other things like that. They don't let Chinese company manufacture everything. They mandate that it need to be sourced locally. So healthcare need to be changed like that. We also need to bring in free market principles in healthcare, like hospitals do not compete with each other. Imagine if one hospital in Pennsylvania had a sale going on versus a hospital in New York. People will flock there, try to get best pricing. So there's one thing which we can see in capitalism in healthcare in America is in this field of LASIK eye surgery. That is not covered by insurance. Same is for plastic surgeries, not covered by insurance. So those two specialties or procedures, in the past 2 decades, the price have come down dramatically. The quality has went up because the doctors are competing with each other, and no insurance company is paying for LASIK surgery. But it used to be thousands of dollars per eye to do a LASIK surgery. Now it's a couple of $100 or maybe $300. Same is for plastic surgery. It is the survival of the fittest. That's what pure capitalism is.
It's fascinating because when you started talking about healthcare and you said that healthcare is for everyone, you're one of the few people that continue by saying that, we should take this path of being capitalist healthcare as opposed to that federal approach to nationalization of healthcare, which we've seen fail in so many other countries because they had the same vision. And the vision that you had about the healthcare industry was noted and picked up by a Senator John McCain.
Yes.
Is that correct?
Yes.
And you went on to work in
with President Bush. Yeah, supported President Bush's campaign, and then with his brother, Governor Bush, until Trump came into office. But now I'm supporting Vivek Ramaswamy because I believe he has a vision which can change this around. Because bureaucracy is not the answer. Private capitalism, free market principles can change things around, whether it is business or healthcare. If people believe that there is competition among providers, and if everyone who deserve, but we also need to provide a base layer of security, safety net for everyone who deserves it. In the sense, that's why in my book I propose that we create a national safety net of county hospitals. So it's changed the system currently from a single payer or a private payer system to a dual payer system where it's not government insuring everybody, government provide hospital care. It's a lot cheaper to hire doctors than to provide. So, like for example, if I want to protect your life, I won't buy you life insurance. I'll try to save your life from doing something. Buying insurance is only, fattening the pockets of insurance companies. Same thing here. It's all about whether it's Democrats or Republicans. They're all talking about is buying insurance for you. Maybe insurance is not the solution. Maybe providing care is, similar to what VA is doing. Maybe you can open up those things to people who have Medicare or Medicaid, and is as Vivek says all the time. If you dismantle these organizations, the government bureaucracy of CMS, you could actually give $8,000 to $12,000 per person per month, so they can shop for their own insurance. Imagine if instead of calling it, we call it healthcare, but are we truly caring about anyone's health? We care about diseases. You get sick, you come to us, we fix you. You get sick again, we fix you again. But are we caring whether you are working out? Are we caring whether you are following a nice lifestyle? Are you eating right? Are you stop smoking? Are you abusing alcohol or drugs or whatever? Is your mental health in better? Is it the health of mind, body, and spirit, or is it just fixing diseases? Right now, the incentive is that if you get sick, I'll do a procedure on you. Like if you get a heart attack, I'll put a stent on you. I make money. Hospital makes money. Everybody's happy. It's $50,000, $60,000. You're out. But imagine if you can prevent that heart disease from developing by asking somebody to, hey, if you go to gym 3 times, 4 times, we're going to incentivize you. Your premium's going to be much lower. Imagine if you eat a healthy diet, whether it is vegetarian or not, sattvic or not, doesn't matter. If you can eat a healthy diet, and if you stop smoking, we'll incentivize you. And if not, we'll penalize you. So if there is carrots and stick in maintaining health as opposed to disease care systems, we can better manage the way things are, and potentially create a better, healthier America. Um, that's what I thought, somebody can achieve it. But the way currently it is done, it's not going to survive for long.
We look forward to reading your book, and I hope you'll come back and speak to us
Thank you.
afterwards. And thank you so much for sharing your vision with us. Healthcare is such an important issue, not only, of course, for the immigrant community, for Americans, and for the next generation as well. I mean, people are terrified for their children. So this is really a service you're doing to all of us. Thank you.
A country which is not healthy, will not survive for long.
That's right.
So plus, we also might need to uncouple our health insurance from employment. Imagine if your health insurance is with you, like your car insurance, versus, it's tied to your employer. You're more free to jump from one job to another. You're more free to start a new business if you're not worried about healthcare. If insurance is your own, like your car insurance, so there are things we can do, legislatively to change the way things are and make things a better place for our future, for our kids.
Well, thank you so much
Thank
for
you.
that.
Thank you.